Hi, I'm Sandeep, and you're watching the Indian Weekender. As you all know, that National Party has launched its COVID response strategy yesterday, and which talks about opening up New Zealand. It is a three-pillared approach where it talks about invest, where it talks about evolve, and then eventually opening up. So to talk more on this, we have got National MP and spokesperson for COVID response, Honorable Chris Bishop, joining us from Wellington today. Welcome to our digital studio, Chris. How are you today?
Very well. Thank you, Sandeep. Nice to be here. Good to see you again.
Right. Okay. So as you have talked about this policy, the COVID response policy, I would say it was much awaited. Probably we have been into lockdown for already 6 to 7 weeks. So what took this long for National to come up with a coherent COVID response policy?
Well, I suppose the first thing to say is that we've pulled together a lot of the things we've already been saying. So, we've been saying for a number of weeks now that we need saliva testing as part of the Auckland outbreak. We need rapid antigen testing, which people watching will know are those tests you can get. They work a little bit like home pregnancy tests. They take about 15 minutes to give you a COVID result or a test result. They've been banned in New Zealand. You can't get them. So we've been saying things like that. So part of the putting the document pulls together a lot of things we've already been saying.
Sure.
But I suppose the major strategic change in our document is that we want to explicitly move away from elimination as a public policy goal towards suppression. And that's just the simple acknowledgement, Sandeep, that COVID is here. It's not going away. 45 cases yesterday in Auckland. Auckland's now been in a level 3 lockdown for 7 weeks. We gave elimination a really good go, but Delta is just too transmissible.
Sure, certainly I would come back and speak more about this change of strategy of giving up on elimination strategy and working on a vigorously suppressing strategy. We all know about that. But before coming to that, I would like to get a better understanding of where is National's emphasis today. When we are dealing with a pandemic, there are, like every other problem, there is three horizons. One is the past, one is the present, and another future. So we know that New Zealand has pursued elimination strategy for the last 18 months. And what we also know that we have been dilly-dallying in terms of vaccinating fast New Zealand population. So that is past. Now we are today here. Auckland is still in lockdown after 7 odd weeks. Rest of New Zealand is on level 2. And then obviously there is the future as well of opening up New Zealand to the rest of the world. So if I have to ask you, where is your emphasis? Where is National's emphasis today? Moving New Zealanders out of lockdown or connecting to the rest of the world? Where does National's emphasis today?
So the first thing right now is we've got to get out of lockdown in Auckland, obviously. And the way to do that is to vaccinate as many people as quickly as possible and then surround the areas of Auckland where there are outbreaks with rapid tests and saliva tests and isolate those who test COVID positive. But we've got to get those vaccination rates up. And frankly, the government has taken way too long to vaccinate. You made mention of the slowness. For most of this year, we had the developed world's slowest vaccine rollout, and that's on the government. They've got to own that. It's their responsibility. So first priority in the present, vaccinate, get as many people vaccinated as possible. Test. We should be using saliva and rapid testing, and then eventually go down from level 3 down to level 2. And then, we also want to, in the short term as well, after that, get to a vaccination rate countrywide of about 85% as a milestone, and then allow people who are doubly vaccinated, New Zealanders and people, permanent residents overseas, to come home to New Zealand.
Sure, certainly. I will come back and speak on that. Now, coming back to opening or moving Auckland out of this lockdown. So if government has to go ahead and adopt National's policy in its entirety, as Leader Judith Collins has proposed and invited the government to do that. So if National Plan was adopted in its entirety, then coming Monday, when the government has to go and announce a decision on Auckland's alert levels, do you think we will be ready to move Auckland out of alert level 3?
That's a tricky decision. I don't know is the short answer, because I don't get the public health advice that the government gets. Where are we today? We're Thursday today. They make a decision on Monday. It's hard to know at this stage. The government's in a very tricky position because he had 45 cases yesterday. I mean, level 4 was meant to work. meant to get the cases down to 0. It didn't. Level 3, it's meant to have the same effect. Obviously, we've had a spike in cases that may or may not continue. I suspect it probably will for a few days. So let's just wait and see.
Sure. So under national plan, as you said, that national would be ready to remove New Zealand out of lockdowns once we achieve 70 to 75% of vaccination goal. So right now, New Zealand is sitting at 44% of double vaccination and around 78% of single vaccination vaccinated case. So by that number, by that goal, we are still, I think, a few weeks away when we are able to reach to that 70 to 75%. So under a national plan, do you think we will still have to stick and live with this lockdown?
No, we want to get out of lockdown as soon as we can. And, you know, we made the point earlier in the year that if they'd vaccinated quicker, then we wouldn't have had to be in lockdown in the first place. The lockdown is wholly caused by the vaccination slowness and the lack of, the low rate. So you're totally right. You know, the double dose rates are still too low. So we're just got to get on with it as quick as we can. But the aim of public policy has got to be to get out of lockdowns as soon as we can, because Auckland's now done 17, heading on to 18 weeks since March last year. You know, I'm a Wellingtonian. I live in Lower Hutt, Petone. I've got colleagues in Auckland, though, friends, and man, it must be so hard up there. It's just
it is certainly hard. It is very hard.
Devastating. It costs the country about $1 billion a week when the country's in a nationwide lockdown. It's several hundred million when Auckland's in a level 4, even a level 3 lockdown. So we've got to get out of it as quick as we can.
Definitely. No, I do completely understand and agree with that. This is not financially sustainable. It is not sustainable emotionally and in terms of mental health issues it's creating. But the thing is, and that's an important thing, that when we see some surveys done in the recent past, there is still some residual support from New Zealanders towards government's elimination strategy. So how is national responding to that? Like, have you been able to capture the public mood correctly, or do you think there is enough public sentiments to move out of lockdowns?
Yeah, I mean, elimination enjoyed a lot of public support for a long time, and it made sense as a strategy for New Zealand when Delta didn't exist and when we didn't have vaccines. A couple of things have changed in the last few months. One, Delta has become the variant all around the world, including in New Zealand. Highly transmissible. It's just a completely different form of virus, to be honest, and it's taken us a while in New Zealand to get a head around that, because it turned up here basically last, because we're the bottom of the world. And then the second thing is, the vaccine has completely changed the game worldwide. If you look at other countries, they're not doing lockdowns anymore. They're opening up. They're removing restrictions because they've got a high level of vaccination. And that's why it matters that we were so slow this year. I mean, we were saying back in February, March, April, why are we going so slowly? Other countries are racing ahead of us. And now, of course, we're catching up, but it's been too late. So I think elimination enjoyed support while there was no vaccine. But, as I said before, Delta's here now, 50 cases yesterday. We're up to 1,200 in this most recent outbreak. We're now gone on for longer than the initial lockdown last year. Well, at this stage in the lockdown last year, we were down to 0 cases each day. Well, now we're at 50. So you've got to say elimination is not working, unfortunately. We need to pivot away from this idea that one case of COVID in the community is a disaster. We can cope with it. We can manage it in the community with a high vaccination rate and some of the tools that we've talked about in our plan, like rapid tests and saliva tests, isolation, proper contact tracing. We can do that. And if the government adopted our ideas, that'd be a good thing.
So would you have any idea like why government has not considered this rapid testing and to adopt those kind of already proven technology overseas? Like why the government has been reticent? Have you got an understanding about that? Yeah,
so to be fair to them, in an elimination scenario, and this is why the strategy matters, when you're trying to eliminate COVID, the accuracy of your test result really makes a difference. So when you do a test, you want to know absolutely if someone's got COVID or not, because it matters, right? One case matters. So that's understandable, and the government doesn't want people doing rapid tests in an elimination environment. Once you move to suppression, and where you're trying to rapidly test as many people as possible and identify the positive cases, rapid testing makes a massive difference. And so you can use it for what they call community surveillance testing, which is screen people on their way in, as they do overseas, screen people on their way into events, screen people at hospitals, screen people in the community, test as many people as quickly as you can, so you pick up the positive cases, and if you get something wrong, well, it's not the biggest end of the world, because you've got a different strategy underpinning what you're trying to do. So rapid testing, as a lot of experts are now coming out and saying, does make sense for New Zealand. Just the government hasn't done the work, so it's like you literally can't import these tests into New Zealand. The government's doing a trial, but it's way too slow. We should have been ready to go with this stuff, months ago. And
definitely. And certainly, like a lot of New Zealanders out there are feeling the same way, that probably we have wasted that 18 months of wonderful window that we had. Now, coming back to some other practical issues that we want to get understanding, like government says that we have seen a recent spike in the vaccination rates, particularly after the Auckland has gone into alert level 4 lockdown, which tells that probably that vaccination was more driven by fear of people, and that's why probably we moved from 21% before lockdown to around about 44% where we are at the moment. So what I want to understand, like under a national government, what you would have done differently to incentivize or to bring people to vaccination and to agree to vaccination. What national would do differently than what this current Labour government is failing to do so?
Okay, so the vaccination story actually starts 16 months ago, back in May 2020. It was in May 2020 that Pfizer started reaching out to governments around the world, including New Zealand, saying, we've got this amazing new vaccine, you should come talk to us and buy it. The New Zealand government didn't form a negotiating team to deal with the drug companies until August, and there's a 3-month window there where we didn't basically engage in much vaccine negotiation. So we didn't engage until August. We didn't sign our first contract with Pfizer until October last year, which was later than almost every other developed country. And then we didn't actually sign our final contract, like our definitive supply agreement, until late December 21 or 2020 or 22. And so all of that's made a difference, because it meant that when the supplies turned up in New Zealand in late January, early February, that was after a lot of other countries. So the timeline makes a big difference here. We were late on everything. We were late to sign. We were late to approve. We were late to get it into the country. We were late to actually put the physical order in. So that's the first thing. And then the second thing is, we just have not made use of tools that you'd expect. Like, it takes forever for a GP to get accredited to administer the vaccine. If you're a GP in Auckland, a couple of weeks ago, there was, I think, 115 from memory, 115 GPs administering vaccines in metropolitan Auckland. There's 400 GPs in Auckland. Like, why are we, and this is in September, why has it taken until September to get a quarter of GPs in Auckland administering vaccines? As you and people watching will know, GPs are where you go. They're trusted advisors. They're trusted confidants of people. People trust their local GP, the family doctor, who they've gone to for years. People should have been able to get vaccines at the family GP, since March, April, and it's just been nuts that they haven't been able to do that. So that's a big factor, I think.
Definitely. No, I completely agree with that. That GPs are the first most trusted health advisors that people would love to go and see. And the other thing is, probably, I don't know, like, if you agree, like, do you think was there a lack of strong drive from the government to incentivize people to actually come out and vaccinate and take a personal responsibility? Because what we think is probably I don't know, like, if you agree with that or not. Like, we have been too soft on this. That people, they can vaccinate whenever they feel like, and basically that is affecting the safety of the rest of the New Zealand, isn't it?
Oh no, look, I completely agree with you. I mean, one of the problems was the Prime Minister spent quite a bit of time in the first 4 to 5 months of the year saying things like, "Look, it's not a race. We don't have to be first. There's plenty of time. Don't worry about it. Other countries need it more than we do." And she basically said to New Zealanders, "Look, vaccination's important, but we can take a while over it." Well, as it turned out, that was a massive mistake, because Delta turned up in our MIQ here in April. We started warning alongside public health experts from about April, May, that Delta was here, or was going to turn up here eventually, and we needed a high vaccination rate. And as late as April, the Prime Minister was saying, "Oh, look, it's not when you start, it's when you finish. Don't worry about it. It'll take a while, but that's okay." I'm sorry, that is just negligence. That is just a failure of leadership, and it's just negligent public policy. The vaccine numbers make a massive difference. If we'd been at 60% on August 7 in Auckland, life would be very different in Auckland right now. When Delta turned up on August 7, a few weeks ago now, in Auckland or countrywide, there was a 20% vaccination rate. You know, if it had been 50, it would be a completely different story. And that's on the government. That's completely on the government.
Right. Okay. Now, coming back to the vaccination target, you are saying that probably at 85% we will be ready to open the world, which is again shorter than what government is saying. Government probably seems to agree, haven't they? They haven't come out and say that 90% is their goal, but they seems to be agree with others who are proposing for 90%. So at 85%, do you think National would be confident to open the world? Do you think we will be ready to do well with this suppression strategy?
Yeah, I mean, 85%, you know, like it's a big number, right? Like I know the government keeps going on about 90, and the Prime Minister says they don't have a target, that they actually do have a target. It's 90. I mean, 85% is a very significant number. It would give us a huge number of people vaccinated. And then you do that alongside rapid tests, saliva tests as well. It's not just vaccination only, it's vaccination plus other public health measures. So look, we think we can get there. And once we get to that point, we think we should start to allow double vaccinated travellers from overseas to come home and travel out of New Zealand as well and then come home.
Sure. Now, on that, probably I took a note that probably a lot of people, they took a note how you have described the MIQ as a human misery of a lottery system. So what kind of stories have you been hearing from people who have been dealing with this MIQ system?
Oh, look, it's truly awful, to be honest. I mean, people out there watching will probably know. I mean, the people haven't seen their kids for 2.5 years, have been overseas, want to come back to New Zealand, split apart from loved ones, can't come back for funerals, urgent medical treatment, people who've actually had their visas expire in the country they're in who can't travel back to New Zealand. That's not a good enough reason to come home. So they're illegal in the country they're in, and they can't get into the country that, you know, they're a citizen of or a permanent resident of. So look, the stories are just awful, and you know, people logging into this website to try and get the MIQ rooms, 3,000 or so at a time. There's 30,000 people on the site. You know, you've got a 1 in 10 chance. It's just, and you know, people sit there for hours. It's just awful. Like, it's a truly terrible process.
Certainly. Well, I agree with that. It's quite awful. But don't you think that New Zealanders who are right now living in New Zealand, probably they are not concerned with them a lot, and probably they seems to be okay with the Prime Minister Jacinda Ardern's government, the way she's keeping the border closed, and probably and to say that probably they are not listening to what National is proposing. So why is that, and how National propose to turn that around?
Oh, I reckon you're going to see the government start to listen to some of these proposals. I mean, they themselves, to be fair to the government, they would say to you that they're in favour of reopening the border. They just got a slower time frame than we do. They don't have a plan to do it. I mean, we've actually put our cards on the table. We've said 85%, start to allow double vaccinated travellers from low and medium risk countries to come home or travel offshore. The government says they don't have a target, even though they kind of do. They say they're rethinking all their plans, but also their plans are still government policy. Not at all clear what their actual plan is. I mean, we're being upfront with New Zealanders. You know, we're making a virtue of that. Go to suppression, recognise there'll be COVID in the community, open up, because we can't keep living in splendid isolation forever. And the human stories, you know, are just horrific. So let's just get on with it.
Sure. So before I let you go, one last question. It's about experts who have vetted National's policy. I do understand that National would not reveal their name, and that's quite rightful reason. But can I ask you that more about those experts? Like, are they based in New Zealand, and they are New Zealand-based experts? Because what we are keen to know that are there New Zealand-based experts who would support a vigorous suppression strategy instead of elimination strategy?
Yeah, look, we haven't publicly named the experts we talked about, and the reason for that is a lot of them, you know, work in and around government, and they don't want to be named publicly. But I can tell you that we've had some very good people working on it, and you know, I think you are starting now to see people talk about vigorous suppression publicly, or a suppression strategy more generally, and you know, I think that's inevitably where things are going to go.
So those are New Zealand-based experts?
Yes.
All right. Okay. So thank you very much, Chris. I think we had a good discussion about this and a better understanding of National's COVID response plan, which is definitely far more coherent than what we have heard probably around 16 months ago, when probably COVID was new. So thank you very much for your time. We'll come back and speak to you again when time permits, and to get a better understanding how National would have done things differently than what the current government is doing. So thank you for time today.
Great. Good to talk to you.
Thank you.